Good evening, dear viewers, and welcome to another episode of Health Link, brought to you in the studios of QTV by your host today, Shamila Jah. I must say that I'm very, very excited and happy to be here once again with you all. I'm here also in the studio with very important guests, and I will introduce them to you shortly. We all know we are in the month of Ramadan, the month of fasting. And fasting has a lot of health benefits if you do it rightly. So today we'll be focusing on fasting, but we'll also open the lines so that we hear from you on your health concerns, and our experts here will be answering your questions. And let's not forget that we are in COVID-19. So we will make sure that whatever we do, we will be discussing it in the context of COVID-19. So to introduce my guest, I have on my right here the Director of Health Promotion and Education. Everyone knows him. He's Mr. Modun Jai. He's a household name, and he's really done a lot in promoting COVID-19 and helping us understand it better. And I have on my left side a very senior public health specialist in the country. His name is Mamadou Gassama, and all of you also know him. So as you can see, we have very, very a lot of expertise currently in the studio. So to begin our program, dear viewers, I'm going to ask the Director of Health Promotion a very important question. Director, you're welcome to this program. The COVID-19 vaccine has arrived in the country a few months ago. I think it's less than 2 months. And we are now currently in Ramadan, the month of fasting. Many people may be wondering whether it's okay to take the vaccine while they are fasting. What is your advice on that?
Thank you very much, Dr. Shamila Jah, for inviting me to this important forum, where we'll be talking about Ramadan and health, but we also talk about COVID, because we are really still in a situation where in COVID. The question you asked really is a very important one, and I just want to tell the audience and viewers of this important program that taking vaccine while you are fasting has nothing to do with your fast. Because of the fact that the vaccine itself we are going to be vaccinated with does not have any nutritional vitamins or any other food substance that is added into the vaccine that can affect your fast. So the vaccine doesn't have any of those contents, so automatically one can fast and as well as take the vaccine and you move along with the fast. It has nothing to do with the fast. That's I want to make that thing very clear. So anyone who is also skeptical about that maybe when you take the vaccine it may break your fast, I want to assure you that you can still continue taking the vaccine while you are fasting.
Thank you very much. That's very important, and I'm sure our audience will appreciate that in the local languages as well. So maybe my colleague on the left can help us, Mr. Gassama, to translate this for our viewers in Mandinka.
Abaraka mbe badingol be kontonna ngal bismillah programme o nyinto nyen kontan baga folo QTV mbal kontonna mbal jayla mbal tentula nyim programme o kumata baga nyin Health Link. Comme na kafu nyuma men foten fon doko nyomo Ndiaye ya nyinin ka men na wala fo ni ibe sundi mbay mbe sun karolo kono nyim pengo dumbe kering nyim kuran njaw kumba nyim COVID-19 ay mo be detandi mba ala en dema fo sa nyim pengo so dala mbe mul walin kanke pengo docteur ya nyinin ka men na fo ni membe sundi fo nyanta pengo kala fa ala sungole tele ban fa tinyala bar modi ya jabi nyame nga banne ko ñim ni ngo man ñoo soto fenna bari femmen domor femmen tara kono wala jiman tara kono men safu ko ya dum mo jaato ko na sala sungo tay ñim penko ya de da ñame am man tara kono oto kam ni be sundi ñaw ñama yesi ñin tale penko ñin ta ye fan tanka ye mo ko ten tanka tana woto na teje modi ya jabi na la.
Thank you very much for translating that for our viewers. Also, while you're on it, Chief, we all know that you are a champion of physical activity. During fasting, what is your advice with regards to physical activity?
Thank you very much, Chief. I think this is a very important question. Whether we are in Ramadan or not, physical activity, it is key, it is very important for our health. When we say physical activity again, we have to be mindful that it is not restricted to one activity. Physical activity is a big, big basket, if you want to call it. It's a big box. So which simply means you can do a lot of things. Physical activity can be sport. If you are a good runner, you can do it, if you can. Physical activity can be walking, brisk walking. You walk. Everybody, we all walk, one way or the other. Physical activity can be even sitting at one place and making sure your body moves. So whatever movement you do, and that has an effect on the skeletal muscle, that's what we call physical activity. So physical activity generally is good for our health. Now, when you are fasting, it is important to, never mind you are, because there are people also who will think I'm fasting, so I don't need to walk. Your body needs it, because when you, especially those who are overweight, those who have really, their weight is not very healthy, or some of us are obese. So walking in your routine way, it is very good. So physical activity is important, because if you don't do it, if you are not physically active, you are also exposed to other diseases. Diseases like, because when you are not physically active, you put on weight. And when you put on weight, excessive weight, you are now going towards getting diabetes. You are now going towards getting hypertension. And these are very difficult situations in our country here. And not only here, but outside. So physical activity is important.
It's important.
Yeah.
Okay.
I think to add on to that, I think what you said rightly about Gassama, that's a true description of Gassama. He is really a champion of physical activity.
Yes.
I imagine somebody who lives in Bruceville and works to WHO office on a daily basis.
Exactly.
He's really a champion.
Yes.
And I think physical activity, as you already mentioned, if we are really, we want to really tackle NCDs, non-communicable diseases, as physical inactivity is one of the risk factors.
Yeah.
Exactly.
So automatically we have to really embark on physical activity.
Exactly.
And evidence have shown that in this country, not many people participate in physical activity, either in the sport form or in walking or whatever.
Yes.
It's still low.
Yes.
So we still have to make sure that we emphasize on and we embark on physical activity at all times, especially when you are fasting. Like when you break your fast, after iftar, you can have maybe 30 minutes, 40 minutes walk, or even up to 90 minutes. Just walk around. If you think you can go visit neighbors, you can walk towards the highway.
Yes.
And before you start the prayers, you can still do that exercise. And if you think you cannot do that early morning, when you take, after eating, you can, after from the mosque, you can even walk around.
Exactly.
You can have maybe 30 minutes, 1 hour walk. A distance. At least when you come back, you can now relax and then take bath and then go to work.
Yes.
It has nothing to do with your work.
Yes.
And also it has nothing to do with your fasting.
Exactly.
It's also going to keep you healthy.
Exactly.
That's the most important message we want to put across here.
Yes.
Yeah, thank you.
Because like Modunjai has rightly mentioned, exercise has to be done at the right time, so that it doesn't also give you additional stress that your body cannot tolerate. So just before breaking your iftar, breaking your fast, 90 minutes before is a very good time, like he said. And also, if you cannot do that, then early morning when you wake up maybe 30 minutes or 1 hour earlier, and then you do some activity, and then you can have your heda or sahur, and continue with your fasting. Yes, thank you very much.
I think also, for me personally, what I normally prefer is like when I break my fast, I just walk around.
Okay.
That is all, because at least I know I'll be heavily eating at that time. I must have eaten heavy meal.
Exactly.
So I need to go, just a bit of walk, and then get the the food be a bit digested, and then from there, then they can also think of what activity. Or sometimes I do it in the morning.
Exactly.
So I think it's important that we do physical exercise.
Right.
Because when we don't do that, we're still encouraging the spread of NCDs, or maybe trying to encourage NCD to open doors for NCDs to come.
Sure.
So I think it's important. We are not here. We should not encourage. The rise in NCDs in this country. We still all work towards cutting down the numbers.
Exactly.
So I think it's important that we practice. We make sure that we do physical exercise. We also make sure that we eat healthy diets, and especially in the Ramadan. It's very, when we talk about healthy diets, we'll talk about that in detail.
Yes.
Thank you.
So dear viewers, also the lines will be opening shortly. The number will be appearing on the screen, and the number to call is 50505. 5050505, and you're welcome to ask any questions, not even just limited to this topic we are discussing. Anything of interest to you and concern to you, please feel free to ask. So, Mr. Njai, you're talking about the healthy diet during fasting. Can you elaborate on that a little bit more for our viewers?
Actually, what I mean here is that in this month of Ramadan, if you look at the way we eat at home, mainly the foods are either, sugary foods or fatty foods. In most cases, also sometimes salty foods. And all these foods really, for us and for the health practitioners, we see those ones as unhealthy diets. Because we know that fatty foods are either, for example, frying with, for example, oil. All the oil we use in most cases are fat. And in addition, again, you also add other fats on top of it. And then you eat that and you relax, without doing proper exercise. And really, this could have an implication on the individual.
Exactly.
So this is what we are saying, that these are unhealthy diets. And what we also encourage is use of fruits and vegetables. If you can eat those ones, either when you are breaking fast or even in the morning. I think this, especially watermelon at this time of the year.
Okay.
Melon is very key, cucumbers and so on,
Yeah.
tomatoes
Director,
and all that.
we have a caller already.
These are very important foods at this point of the year.
Okay.
Yeah.
Thank you very much. Hello, caller. Hello.
Hello.
Yes, you're welcome to the Health Link program. We can hear you.
Thank you all.
Good
Yes.
evening.
Yeah. Okay. Thank you so much. I just want to ask a question.
Yes, please go ahead.
Yeah. I don't know whether Mr. Njai, whether you can help me, advise me as to what to do, because I have been having this stomach ache for so long now, since well before Ramadan. I went to the health center. I was diagnosed. They said I have this thing. How to call it? Septic.
Gastritis?
Infection, rather.
Infection, okay.
So I was given medication. I took that medication, but no avail.
Okay.
Right now, I went back and I was advised to go for scanning. I went for scanning. They said it's not anything, which is really disturbing me. Even the fact it's a problem for me. What is your advice, please?
Okay,
I'm
sister,
not sure
we
the
can't
line-
really
yeah,
hear you.
the
Your
line
line is not very clear.
We cannot hear.
We heard you saying that you went to the health center and they were diagnosed with an infection.
Yeah, and I'm getting.
I think we have.
We're
Yeah,
losing the
unfortunately, the line is gone.
So I was given the medication. I took the medication, but still now to no avail.
Okay.
Okay.
It's really disturbing me, honestly.
Okay. I think the advice for now, what I will give you, like, I don't know whether you've gone to the health center. If yes, perhaps the health facility there can be able to refer you to the next level and for management. And I think the next level could be either a district hospital, and if the personnel are there who can manage. If not, they'll also refer you to the next level, which could be a general hospital, and then to the teaching hospital. So I want you to explore that, see the person who have seen you first,
Yes.
and then let the person screen you more, and then talk to you more, and also refer you to the next level. I think that's it. I'm sure you are calling. Perhaps you must have gone to the health center, and then they can also now review you and then refer you to the next level for further review.
Exactly.
And then I think then they'll be able to know if, for example, you need to go through certain scanning. For example, you need to do scanning, you need to do other things.
Yes.
Then all those things will be clear to you when you go to the next level.
Yes, that's a very solid
Yeah,
advice.
thank
Sister,
you.
so he's saying that
I
please
I didn't get your point.
do
information
not just
because
stop
the
at
line
the
was
health
not-
center,
line was-
sister.
yeah, exactly.
Please do not stop only at the health center. If your symptoms continue, there are other places and other channels that you can go.
Definitely.
You can get help. Please make sure you get the right help.
Thank
And
you.
we pray that you get better,
you.
inshallah.
Yeah.
Yes.
Yeah,
Chief,
just
you
just to
want
add to what Modu has said, Modu has really.
Oh, sorry,
Yeah.
before you go, there's
sir.
another person on the line. Hello, caller.
Yeah. Assalamu alaikum.
Walaikum salam wa rahmatullah.
Rahmatullah.
Okay.
We can hear you, brother.
Like a question. Hello?
Yes,
Mashallah,
yes, please
can
go
you
ahead.
ladder?
Wow.
Okay, anyway, I'm a sickle cell patient.
Mhm.
So what
dama bëggoon a ngeen di jàppale ñun sickle cell patients lan la ñu war a def during this Ramadan.
Okay. 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 Thank you very much. That's a very, very important question.
Okay.
We know that sickle cell patients, they are very prone to, when they are not hydrated well, they can have a lot of problems with it. So he's asking, he's a very valid question.
Very valid
Yes,
question.
yes. So Chief, you want to add on? to
Yeah,
that?
I think this is a very important question.
Yes.
It all depends now. You see, you're assessing what is your situation,
Yes,
and that can only be determined by you and the doctor.
yes,
So
Yes.
we would advise, let him not keep quiet. I know
Yes.
he is very conscious of his health.
yes.
So please, my advice
Yes.
is, you don't do self-medication. Just make sure you have a very
Yes.
honest and a very professional advice
Yes.
from a medical doctor.
Yes.
And then you follow the advice.
Yes.
Yes, that's
Yes.
what we can tell you.
Yes.
Yeah.
I think also he may also have a doctor, but also sometimes the doctors will give them advice, and advice some people will not take the advice. So I also advise him to be very close,
Yeah.
to the doctor who is seeing him,
Yes.
and then continue getting more and more information from him
Exactly.
or her,
Exactly.
and then I'm sure he'll be fine.
Yes.
Because if you are if the doctor really assess your situation, will now be advising you as to what you should be eating.
Yes.
Comme que li nga laajte rek docteur soo nekkee da nga def si docteur boo xam ne si moom ngay dem moom def na la jox advice boobu nag moom ngay toppa comme li Gassama wax rek pour ngay dem li gën a feebar yi li ñu gën a bañ mooy su sa amee métti tuuti da nga dem jënd yeneen garab yoo xam ne xëy na xamuloo garab yooyu ndax def laa njëriñ ndax nekkul di la njëriñ ndax xëy na daf laa loor xëy na docteur rek moo la mën a dimbale mu jox la garab boo xam ne moom nga war a naan te mu la war a jox ndigal boo xam ne loolu nga war a topp loolu dafa am solo trop pour nga déggoo ak sa docteur bi nga faa dem toujours nga jël ndigal si moom su boobaa na nga mën a toppatoo sa bopp loolu na dafa am solo trop.
That's it.
Yes. So I just want to add to what my colleagues have already said. So sickle cell, it is, like we said, if you are dehydrated, it can cause you problems. So we know that you must be seeing a doctor for your condition. And everybody who has a medical condition, before you fast, consult, especially those of you who have chronic illnesses. Before you fast, consult your doctor, and the doctor will be the best person because he knows you very well. He or she will be able to advise you very well on whether you can fast or whether you can fast and then do some things with it. So for example, this is general, not for this particular person, but sickle cell patients, they need a lot of water and they need to be hydrated all the time. And during fasting, you need to drink a lot. So between your iftar and your sahur, you should be drinking continuously to hydrate yourself. Now, we don't know whether your doctor will advise you to fast or not. Depending on your condition, he might even say it's not even advisable for you to fast.
Right.
But if you are to fast, you have to be making sure you hydrate yourself slowly. What we do sometimes is we drink. Just before during Heda, some people will take 1 liter of water and drink everything. That is water load. You're loading yourself with water. Before you know it, in the next 30 minutes time, you will go to the toilet and you excrete everything out and even more. So when you are hydrating, try to hydrate over a long period, taking sip slowly, slowly, slowly. That way you are hydrating yourself as well. So this is the advice. And so our brother, like our colleagues have said, please consult your doctor and see whether it's even advisable for you to fast. And if it is not, then please, like Modun Jaya has said, listen to what the doctor is telling you because he knows you very well, and the advice he gives you, stick to that, inshallah. And we pray that, and you know, most of these things, if you are unable to do it, God knows you are unable to do it, and you will, I mean, we are not religious people right here, but we know that God will reward you because you had the intention of doing the fast. It's just that you couldn't do it because of your condition. So we, inshallah, we pray that you.
Dr. Jai, it also reminds me, when you talk about I mean, people hydrating themselves, make sure they drink water.
Yes.
I think I've crisscrossed with my brother in this country. We have gone to almost every community in this country.
Yes.
But what you see, and even within the urban area, rarely you see people drinking water, not even
Exactly,
Ramadan.
exactly.
People don't drink water much.
Yeah.
And I think it's important that drinking water is very important. You have a bottle of water, time to time you drink. And when you are fasting also, when you break your fast, try to drink water as you rightly advise, gradually.
Gradually,
And, and the time to time you just take a sip and then, relax and then take a sip and then until before you go to bed.
Exactly.
So, but you can see that even when we are not in Ramadan, for example, most people drink water only when they have lunch.
Yes.
And or maybe when they have dinner. In most cases, dinner, you observe them, they don't. But when they have lunch, they drink water and that's it. So it's important. Water is very, very important.
Director, we have another caller on the line.
Yeah.
Hello, caller. Hello. Hello, caller.
Hello?
Hello, yes, we can hear you. We can hear you, my brother. Go on.
Hello?
Hello, we can hear you.
Hello?
I think we may have a problem
Hello?
with this line. Hello.
Okay, Njay.
Ma'am?
Dama dong buka like ko am diabetic. Dama muna use hal o sorant abu mango.
Okay.
Lola buka na ham.
Baax na.
Jërëjëf.
Jërëjëf.
li nga laajte ni xam nañ ne xaal yu bari sukkur daf dee bari foofu. te mango yu bari daf dee bari sukkur. waaye su nekkee da nga am diabète te docteur comme femme nañ ne diabète nga am ñoom sa docteur bi daf laa advice li nga war a def. da nga gis na dañ leen day jox menu dañ laa jox menu boo mu jox la plan dietary plan moom ngay toppa waaw suba la nga war a lekk ngoon la nga war a lekk xëy na suñu gis ne tam da nga lekk loo xam ne dafa am sukkur te daf mun naa am soo ko lekk tam mun naa laa sonal tamit dañ laa wax ne bul lekk loolu. waaye tam lekk bu nga wax ni tamit comme ni ma ko waxee rek xam nañ ne xaal yu bari so man su ma ko lekk ñu bari su ko lekk dañoo xam ne dafa bari sukkur. da nga gis ne mango tamit xëy na tamit docteur bi tam di la advice pour nga lekk loolu waaye li ma la advice mooy nga dem jegeñ sa docteur nga laaj ko lan nga war a lekk ala la nga warut a lekk. su la waxee loolu nag waaye am na ñoo xam ne tam dëkk naa ñoo xam ne tam suñu la waxee ne buñ lekk yàppa buñ lekk lenn o ba bu lekk lenn ñoo ne xanaa kii dafa bëgg ma dee bëggut ma lekk lu ne te waaye nag soo gisee ñu la advice loolu nag loolu moo baax sa yaram bi te loolu moo baax sa wérgu yaram te loolu moo tax ñu la advice loolu waaye loolu nag dafa nekk loo xam ne dama fu nekk ni mun naa wax ne daal sa docteur bi daal lu mu na advice nga topp loolu daal loolu laa la bëgg a loolu laa foofu laa bëgg a dëgëral waaw.
Thank you very much.
I think,
Yes,
yes,
Steve.
just to add of what Moda said,
Yes.
you know, there are 5 tips to healthy diet, whether you're in Ramadan or not. The first tip is eat a variety. Don't depend on one food. There is, in fact, the only food, as far as experts say, the only food that has almost everything that you need is the breast milk. Apart from that,
Yes.
no one food can give you everything.
Everything.
So where you eat as much as you can in varieties. Like now Modu has said, we are in this season now, where you have fruits, you have your rice, you have your maybe your potato if you want. Then you have, of course, if there is any milk you have, you drink. So you need to have a variety. You eat a variety. But again, when you talk about diet, you also have to ask yourself a few things. The availability of the food in your environment, your age, your health condition, all these things. That's why the diabetes thing has come up.
Exactly.
So you need to look at all these things. If you are sick, you know that this food is not good for you. Please avoid it if it is really something that you have been advised to do. So we advise that it's a very complex thing when you talk about diet. But in Ramadan, we should, number one, the variety, as I said. You also have to limit, like Modu has said, the level of sugar that you consume. And where do we get the sugar from? A lot of places. We have our tea,
Yes.
we have our wonjo,
Yes.
we have our canned drinks,
Yes.
and we have so many things on the table, and
Exactly.
all of them are sugary.
Exactly.
So if you are a diabetic person, avoid
Yes.
that.
Yes.
That is dangerous.
Yes.
Now the other one also is salt consumption.
Exactly, salt.
Salt also is important. It's important, but we should also be mindful. The amount of salt that we eat, we consume a day, is also very important that we avoid, because it can also cause. It's also a risk factor for this hypertension you talk about. Now, what we know about it is what WHO says is an adult should consume only less than 5 grams of salt every day. Less than 5 grams. And our research, what we have here, is in here in the Gambia, is that 18 years and above, we average Gambian adult, 18 years above, consume 8 grams.
Wow.
So which means now you already have, where do you get your salt from? The bread that you eat, there's salt. The sardine maybe you use the corned beef. There is salt. There is already salt in the food, the rice that you eat. So there is salt in other things. So where are you now? You one person bringing all these things in the stomach. Then we have a problem.
Exactly.
So this is why these are the tips that we need to bear in mind.
Exactly.
And Modu has rightly said. I mean, this trans fat food
Yes.
that are boiling naturally. Boiling is very good.
Yes.
Boiled foods are better.
Yes.
Fried foods. You want to fry everything.
Everything.
It's also not healthy.
Yes, it's not
so
healthy.
we have to bring variety. The variety is very important here.
Exactly.
But again, it depends on where you are. But we all know at this time of the year, we have seen, thank God, there are a lot of varieties in the market.
Yes.
And Modu has mentioned about vegetables, fruits.
Yes.
There are plenty. Let's eat as much as we can on vegetables. Vegetables are the best if you can. Of course, the others will really, you need energy. You need rice. Of course, we don't prevent you from eating rice. Yes. You need rice because you want energy. But rice is only giving you energy. Then the rest also you get from other varieties.
Exactly.
I think this is
And
important.
I just remembered something you just said about the processed food.
Yes.
We should avoid processed food.
Exactly.
Yes, this like sardines and the corned beef and other things. Let's use what we have in the country, fresh food.
Exactly.
And the other issue you talked about is the trans fat.
Yeah.
That it's not only for Ramadan. This is what he just told us is very important and very useful every day of our lives. So someone even called the Ramadan a 30-day challenge, 30-day health challenge. So what you do in 30 days, if you can do it in 30 days, you can do it for the rest of the year.
Exactly.
So let's take it like that. The issue about the water. Chief, can you advise our viewers how much should they be drinking?
Oh my God.
Oh, sorry, there is someone on the line.
Okay.
Hello, caller. Hello.
Hello.
Hello, sister. Yes.
Assalamualaikum.
Walaikum salam.
Good evening. I'm calling from Nigeria.
Oh, good evening.
Oh, good
Yeah,
evening.
wow.
I'm watching the QTV from Nigeria.
Oh,
Wow,
congratulations.
fantastic. We are so happy to hear that.
Thank you. Please, I have a question for a doctor.
Yes, please, go ahead.
Please, I'm a diabetic person. But after when I take a fast, my hands and my legs will be dry, very dry. So I don't know which advice doctor will give me. It will be dry for some time.
Okay.
Yes,
Which part of Nigeria are you from?
Hello?
Which part of Nigeria do you stay? Where do you live? In the north or the
Pardon?
south? Which part of Nigeria are you currently residing?
Okay, Kaduna State.
Okay, so it must be
From
quite
Kaduna
hot
State.
there. Is it hot there?
Yeah.
Okay. Thank you for that question, sister. Colleagues, do you want to say anything on what she said?
Yeah, exactly.
She's from the northern part, which is typically warm.
Exactly.
Yes.
I think you and your doctor know your situation better.
Exactly.
Like we're going back to the same drawing board.
Yes.
If you have a medical condition,
Exactly.
like what you said at the beginning,
Yes.
seek advice from your doctor.
Exactly.
In fact, this is what I have done. Maybe I fast today and then I've seen this condition
Yes.
in myself and I cannot be myself.
Yes.
The doctor will be the right person there to tell you, please, stop fasting. And I think this religious why you've already mentioned.
Yes.
When you are sick, you don't have to fast.
No.
Because of your condition.
Yes.
So God will reward you, as you
Yes,
said. You have
yes.
the intention to fast. Because of your condition, you cannot do it.
Yes.
So our advice is to people who have medical condition, please seek advice from your medical doctor.
Yes.
You know your body better than anybody.
Yes.
So if you know you do this and you cannot be yourself. And the doctor also added with all the tests that I've done, please follow the advice. Don't be on your own. Yeah. That's what I will say. Maybe if you have anything to add.
That's okay.
I think that is it. Yes.
Thank
The
you.
doctor would be able to be the best person to advise since he would have known everything that is there. Okay, so how much water on average should we be drinking?
Oh yeah, it depends again. It depends who you are. It depends on who you are, what you do, your weight and everything.
Yes.
In fact, if you can drink as much as you can. That's what I will say.
Yes.
Some people will even drink 2 liters of water. Others cannot drink that. They don't have the capacity to do it.
Yes.
So what we are telling people that is, you know, fasting is nearly 13, 14 hours. It depends on the type of the year.
Yes.
But sometimes you can fast up to 14 hours. Can you imagine? Your body has not, you have not drunk anything.
Exactly.
And then, of course, the body has conserved something, your kidney and everything has conserved a little, but you also have to, you know, go to the urinate, and then this thing will disappear. So, like you said, you know, we need plenty of water. Plenty of water is important. And maybe you cannot drink everything at one go, but you know, take it in bits. And then, of course, you can have space for other things. But at the end of the day, it's important to drink, especially when you are beginning to fast. You know, you drink plenty water. I always tell my children, please drink plenty water, because your organs need it. They need everything. You know, our body is 60% of all is water. More than that, obviously we need water. So it depends on your weight, it depends on your size, it depends on your age, it depends on your health. So, but the bottom line is, drink as much water as possible during the month of Ramadan. Not only the month of Ramadan, but water is essential.
Exactly.
Yeah. It's a
Since most of the, like you said, Chief, the majority of the day when you are awake, you are fasting. And the time that is available when you're not fasting is it's the night time where you may be sleeping and other things. So every waking, like he said, during the waking time, between iftar until you maybe lie down, make sure you are drinking continuously. So between the iftar and suhoor, if you know, like he said, liters may be difficult for you to calculate. Minimum, you should be drinking 10 glasses of water, minimum. So make sure you're drinking, even when you go to the mosque to pray, you make sure you have a bottle. As you're praying, you know, when you finish your prayer, before you start the other one, every 2 rakahs, be sipping. Continuously be sipping and hydrating yourself. And when you wake up, also wake up, like we said, 30 minutes or even 1 hour if you can wake up before your usual time for suhoor or heda, and then you be drinking water, sipping it. Don't rush the water intake.
And Doctor, also I want to add that many people, when they are, you know, at time of iftar, they break the fast with cold water.
Yes.
And in few minutes you hear them, oh, I have abdominal pain. So I think the advice here we want to give, at least try to break your fast with hot water, at least. Let's get hot water, and then from there you can, you know, even the advice for now, I think cold water we can avoid it, you know, during Ramadan, if you can. Because like, not, for example, you are in hot climate area, for example, it may be useful, but at least we are living within the urban area here, for example, we know what we are facing now is very cold here. So it's important that we try to get at least water from the tap, you know, when you are breaking fast. If you cannot have hot water, but you can just use that one. And then up to the time that you're going to bed. I think that's also very advisable.
Thank you very much. So dear viewers, we'll be taking a short break, and then we'll be coming back. So please stay tuned. See you shortly.
Ramadan Mubarak from Ajib Bank Limited. This Ramadan, when you open a savings account with Ajib Bank Limited, you will receive a free passbook. And when you open a current or salary account with the bank, you will receive a checkbook for free. Ajib Bank Limited is the only Islamic bank in the Gambia, and we share profits with our clients. So why wait? Visit any Ajib Bank Limited branch today and open your savings account, current or salary account, and enjoy the halal beauty of Islamic banking in line with the Sharia. Ajib Bank Limited, your investment partner.
Welcome back, dear viewers, and we're discussing about fasting and what can we do to make sure that during the time of the month of fasting that we are adopting healthy habits. And in the studio we have 2 important guests, like I mentioned before. Mr. Gassama, regarding the issue about the healthy foods that we talked about, eating healthy. During the time of iftar, what do you recommend for people to do? Should they be immediately eating heavy meals, or should they be spacing their intake? Just like the water we mentioned.
This is a very good question. I think one has to be careful. You know, you have 13 hours or 14 hours, nothing is there. You also have to take it like bits and pieces. That's you don't just jump like, you know, start. You know, I know you are hungry, you are thirsty. You want to do it one go, like some Kiankas will do. No, you cannot. That one is dangerous. You may not even be yours. So take in
Chief,
bits.
we have a caller. We can come back to that. Hello, caller.
Hello, assalamu alaikum.
Wa alaikum salam.
maa ngi leen di nuyu yéen ñëpp docteur Shamila, Mr Modou Ndiaye ak Mr Gassama.
jërëjëf jërëjëf.
maa ngi bëggoon a bokk seen programme bi am na solo trop man la Koura Diouf.
jërëjëf.
waaw lu ma bëggoon a yokkee rek mooy fii wàllum lekk yi ci xale yi tamit.
waaw
seen waxtaan bi am na solo trop because wàllum lekk dafa am solo trop si doomu aadama surtout waxtu weeru koor bii. waaye maa ngi fàttaliwaat ak kan bi rek pour ko ci seen kàddu yi mooy wàllum yi nga xam ne ñoo démb koor ak lekk nga xam ne ñu di ko dencal yi naka ko war a tooyee ko tugi itam bi nekk waxtu boo xam ne yéen xale dañoo toog di taxawal mën a am lu lekk bu baax te dina leex boo fi dañ jox lekk yoo xam ne dafa jël di ko dencal war a liggéey boobu yéen ñaax ak ñu gën a bàyyi am si xel kon li nga xam ne ngeen wax ñu gën cee bàyyi xel su ko defee nekk ramadan boo xam ne incha allah ak ñu fexe ko si incha allah ak ñu bàyyi yéen.
ok
jërëjëf Koura jërëjëf sa da nga ñëw fol sa wax boobu daf ñoo fàttali ne dañ war a dëgëral boobu tam wax boobu. taami weer koor buñ xedee ba pare ndesiti lekk yi lañ jee jox xale yi su suba pour ñu lekk. ndesiti lekk boobu nag dafa nekk lekk bu sedda. mbaa dafa nekk loo xam ne sax daanaka jël nañ ñeex bi yëpp bu fa war a nekk. ñun léegi après li fa des loolu la ñoo bàyyi xale yi. yeneen saa maalo kese la ñoo bàyyi xale yi. te xale yi tam dañ war a dunda. te dañ war a lekk loo xam ne dafa am njëriñ loolu te dafa naa njëriñ te ñoom ñoo gën a solo lekka boo xam ne mooy naa dimbale pour ñu am seen maagaay. te suñu amul façon lekka yu ñu mën a am boobu te dafa am solo pour ñu lekkay na lu ñoo bàyyi xale yi nañ gis ne dañ koo tàngal ba mu tànga ñu balaa ñu ngi koo jox xale yi suba. te suñ ko tàngal tamit nañ gis ne tam suñ ko lekkee su nekkee jeexaluñ nañ ko dëppa defar ko ba mu defar ba baax nga dëppa ko suñ ko solee waatee nga tàngal ko nga jox ko xale ñu lekk waaye buñ leen jox xale yi lekk bu sedda lekk boo xam ne lekk nañ ko suba jeexaluñ ko ñu bàyyi ko noonu la xale yi ñëw suba ñu yàcc ci lekk ñu jox leen ko te da nga gis loolu la Koura di dëgëral ni te dafa am solo trop pour ñu bàyyi xel ñu borom njaboot ñu bàyyi xel si loolu waaw jërëjëf.
And that's even, it just reminded me another thing, that healthy diet is not only about the health aspect of it, but also the food safety.
Exactly.
You make it clean and hygienic. It's all part of healthy dietary habits.
Exactly.
Yes.
Because
Thank
that
you very
left
much for
over
that.
yes.
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 Yes, Steve, you're talking about the
Yes,
food.
I mean, we talk. You see, Ramadan, you cannot talk. These are the two: food and water, food and water, and then other activities.
Yeah.
So, like Modo has said, and already, I don't want to belabor on that. But when you have to break your fast, you should be mindful of, you said you have abstain yourself from drinking and eating for nearly 13, 14 hours. You cannot have everything in one go. Now, try as much as you can. Like the variety is coming now. If it depends on where you are, it depends on what is available, what is on the plate. But if you can afford it, afford it, go for first, have a mixture. If you have, think that will give you some little bit of energy. Yes, maybe rice or something. Yeah, you can have it. Water, and you have even fruits like dates. If you have now around, we have a lot of fruits around, different fruits. Yeah. It doesn't matter whether it's one. You can be any fruit. Yes. So once you have those things, and then like you said, you cannot have everything in one go.
Yes.
So in bits and pieces, it will help you so that you'll be strong and then get more.
Yes.
You can even get more. So that's the, and then maybe like Modi is saying, warm water is good.
Yes.
It will open up.
Yes.
Once some fats that are already there, it will be really dissolve them. So you can have hot water, which is good, and then later maybe for me it depends on the person, but I hardly take cold water. I don't take it. So and it has not like Modo say, if you avoid them, they will not cause you any harm.
Exactly.
I think. But water is what is room temperature is fine, but it really depends on the person if you can afford it. But what is important is you should be mindful of. When you fast, you should really be mindful of what you eat.
I think
you also mentioned about the main
colleagues, we have a caller. Let's just take this caller. Hello? Hello?
Hello, good evening.
Good evening.
Assalamu alaikum.
Wa alaikum salam.
Hello, assalamu alaikum.
Wa alaikum
Wa alaikum
salam wa
salam.
rahmatullah.
Dr. Shamila, how are you and your team?
We are fine. Thank you very much, sister.
maa ngi lay rafetlu seen programme bi am na solo trop.
Alhamdulillah. Thank you, sister.
wax tomb yi ngeen a laal am na solo lool waaye man dama bëggoon a ñaax tuuti rek si benn boor boo xam ne problème la te wax dëgg fa yàlla war nañ di ko bàyyi xel mooy amount of lekk yi ñu dee consume pour prepare pour or dog or da ngaa gis ne yéen a kër ñoo def lot of food ñoo teg di nga def maalo di nga def soos teg façon lekk bu nekk te soo ko bàyyi xel ni nga dee gën a lekkee noonu nga dee gën a soonee lekk nu gën a emee rek noonu nga di gën a amee jàmma di nga bugg a lekk façon lekk bu nekk at the end of the day doo ko mun a jeexal mu mujjee si ñame mbaa mu nekk kasaara digga suñu moromu jigéen war nañoo bàyyi xel bu baax ci loolu dégg la koo oore nag li nga namal façon lekk bu nekk waaye xoolal ni nga ko mën a limité mu em di nga am xiif ak mar waaye xëy na sax xaw ma nu yaaree dog waaye mun nga si ñàkk am sax yàlla foofu de mooy suma boor moom parce que gis naa ne bari na trop si kër yi te war nañ koo bàyyi xel benn weer rek la dégg la de waaye dafa war a nekk ay weer bi nga xam ne dañ war a limite suñ dundal limite bi ñoo emale suñ lekk ñu mun a am yàlla man la Mariama Sarr kontaan na trop si programme bi man leen a jaajëfal di leen ziar.
Thank you so much. Thank you so much, Mariama. No, this is no, this is very.
Buga degara Mariama jërëjëf loolu wax na baax na trop gasama wax na mbiri maalo te xam naa ne ñun Gambia moom soo fi nekkee maalo moom bëgg nañ ko te waaye maalo ñoo def moom ñu bari fi mu nekk diw rek la ñoo tooga pour reer bi diw rek benn ci la mbaa ciw te loolu nag dañ ko war a wàññi yaa ngi lekk ñu ngi wax ne ñu wàññi faat waaw yaa ngi fry diw bi nga koo lekkaati nga ñëw tëddaati non xëy na doo def exercice loolu def nga ko war a bàyyi xel am nañ ay plaças am nañ supa yooyu mën nañ ko tooga noonu léeg-léeg nga dugal nga tooga su nekkee sax amuloo mal sax nga tooga fufu non amin loolu dafa nekk loo xam ne sax dugub sax mun nga koo def yeneen tooga loo xam ne gasama fana mus nañoo lekka beneen lekka Kenya bu ñëw ugaali boobu si dugub la day génn mbaatam si lifin la day génn mbooxa so loolu yëpp mu nga tra nga toog a façon yooyu nga ñu wàññi maalo bi tam li ñoo lekka si weeru koor bi tam dafa am solo trop loolu laa bëgg a dëgëral tam
No, what Mariama said is really true. Thank you so much for also adding to that. The issue about the wastage.
Wastage.
Yes, and it goes also against the teaching of what the month is all about. And you cannot, we may have, there's something that what you crave for is not necessarily the healthiest things. So we normally, when we are fasting, we crave for things, but they're not healthy for us. So we should try to limit, like Mariama has advised, told us, limit what we put on the table. Because what you put on the table is actually, you're disciplining yourself. That means you're confining yourself to eating only what is there. If you don't put it there, you cannot have it. So our ladies, when we are preparing for our families, the health of our families is actually in our hands as the ladies. So we make sure that we prepare things that will not be wasted, will be eaten, and we don't also have to, you know, like Modunjai has told us, use unhealthy types of food. Let's try to reduce as much as possible oil during this month. Please, because it's not only that it's not healthy, but also it will give you other complications like ulcers and gastritis, all of these things, because it's complex fats you're putting in there, in addition to, of course, cholesterol and other things. So, and let's make sure we cook healthy meals for our families and limit the amount of things that we put on the table. Chief, I think we may have to translate the issue about the water intake to our colleague, our viewers in Mandinka, please.
Okay.
Yes.
Baraka be badi won tentula be jayla comme Momodou ani Sambila e même foten ani defana ringo e même fo comme sunkaro be karbala kono bari momen yalan ko e fatata jewma ni domoro fo montro mensta fo wadi sandi saba wala mensi siawte e oto ni ajala o farlo landin kan ni ata ni yano amanka kensende akumata bakela ne jadi kende abe jile abe mu jadi kende damalde bari nga même fenke nga même sunkaro ko ne fon jadi kende nyante kafula yo oto be men domola yemen domo yemen kunu yemen min nyene ben tora kan dunia nyin temena sang nga même min ani nga men domo kono bato dum amanka kuneti sayele wati yo niya bula kono don abe menkela nabe tiaro menkela ko kele yo bayimbe sunkaro kono tan sin domoru nyalun sa sin memen domolun sa kanta bak folo nka sula baka tulo la baka tulo ka tulo do mano ka chunincha abe mosa kanyang osi kanyang do mo kadu mune bol kono cengol mem bol kono cengol mem beta hada badi ngola to nyala cengol do mo di nyanda tara mo kono la bari amen cengol la tambo mem beta sun karo kono dum sunna dum ka hamo ka wara bak musun ngol do ya fu komen tiñaro fanan ka siya ka domoro sunna ka ham ka kamenta men hanta fama fe yela fata domola yo ni domoro siyandi fanan jama ni tu wala baka imam foloma akane ke lanjuro de akane tolal fa domoro fan ngalon ko dol fon nafilo kana ko tay bulu fa ngata nafilo kono be selli ya fani tap lo la kilimodo amon koy yo ngamem fanan fo wala mu baadi ngulu nsi men kandano wala mu jio mu hadaba dingote jio wala be mineral nyaato wala be coca-cola nyaato wala be ni soda nyaato jio la kumata beti be dukare nimbe mingo kala nga jio nga kata jio la yo modu fana afo jango jisuma jama ka jaga jisuma ka jio ta melon ko man sumaya isi domandi an jio fana ita be mina lod la kilimoto ye nyedi wonya hani fo ya domandi yo isi domoro fana chopotin te ya domo wala kumayata yo modi e men foten ko men tolle balube dinni manol kam bak bar mano dammati je domoroti mano ka sembo damaladi ye domoro je niya jibe domoro dolbe je wala ka sembo damaladi domoro dolbe je wala ka jaato fon kende andi men kuma da sayin tembe da naka doku fengol beje yiri dingol beje ni ma bibila eta dawda fingira dawda be tamaro jela tumodo na soto nya ke nyanyi kama mo beta soto nola ba niya jibe wala mu fenti me alon ko kumata tiyo men fon ka tiyo men tiya kendo abetata ke fenke ke wol koran kay nyimi abetata bari tiyo mbiyalo no ko bijan bara tiyo faro tiya ka tiya kendo tik yo bebe jele to domoro kuma da bak ko le ma ka mo andi sunkaro mba kono nga kata domoro nya
we have one caller, the last caller for the day. Let's just take that. Hello caller. Hello. Nungla dega.
Hello.
We can hear you.
Alhamdulillah mbajam
mina ga diaring do
mbajam fo sun garot
la programa interest awakale
baraka
dila min tara face peri ka programa ni jure
okay baraka
ya ndala taka contribute ni na wala ndemu molti mi anko hol sala benna
aja
yeah after or before 3-4 years back kashunanu but this time starting of the Ramadan ngak maslan but I am the stop lekend so man na continue purka sunkaro ni continue purka ama so ngomba ni kala wala yeah false any advice or no please
okay baraka bak ela wongin karo kumata bak ngalan ko ela docteur lo o jibela adunga kiskislo kala balo bala ka don ko on sala bela ado docteur ni samuro docteur ni fanan kanne aye yamar ko foyse sunno wala foyde sunno la ni mbon faka na yamar dila o yamaro noma ko mi nga fojan sungo fanan ela ngani wala prokas fun bari la jare kenda baliya tinda bang ita sunno la o kana tinda fay ku ke mi an ka be mon torola so nga fonu janne ngol folo jassa muru docteur ni kan ya faade ndede kam nga ko sungu commencé ningi ne kedanna abe yamaro didala la ngenta min kala lafta wala be yamar la wala yo kany tamben ni o ke bayla ngani o futala la ngani o timmata ko be sunna lafta sunna bare ma sunno jado kenda yin mo jare kenda sotono bare sa muraka hansan ay yamaro dila mbo yamaro dila abaraka
okay thank you do you want to add
modu yemem fo modu ya banne nko iko jadi iko sonna ma kun tantang ko ngala ka don ite men jato men kenda itle jato tembolo inen doktoro bayi tara doktoro fran wali ye dante ay ko nyina benna ya ite ka nguntango da malake ba doktoro si giba ni nguntango di ay mona wulu yo sai nal don ta kanna ko sai nyina ben nyina munna courant nyinte na lod laba in tembolto doktoro ko ite nyanta singobula ni man singobula abe ine matu man toro kelel yesungo bula ngamera ko tol manka dina ngita nyaato ko be jele kamem moyla sarunga balan sungo boyndi moye men man kende ngaji ke o be sabatri ne bare tol manka usasolti ngalon ko ni usasol fana programme so be bol fala bare kamem moyla lon nali men fo ngame wala be ji wala be sabatri modi ya fo nyame donc to na e fatandi men don ndu atu le jate kendala ngamana sari fana yam fatene ka sumu buleji abaraka wala lalaji.
Okay, thank you very much. Chief, can you summarize like what we have talked about today for our viewers, so that when you're done, then Mr. Njai can
Yes,
also
I will just summarize. Modu, I'll give the rest to my brother.
Yes.
First, Ramadan Kareem to everybody. Ramadan Mubarak. We are in a very holy month. One thing is we have to be mindful of what we eat and what we drink. What we are talking about here is healthy food and healthy drink. What is healthy food? Food that will really reduce your fat consumption. You don't want too much oil. Please reduce it. And of course, eat as much variety as possible. Vegetables, fruits, they are very good. And of course, our local diets, we don't want you to abstain from them. But we need to really make sure that we take a little bit of each. Now, the other one is healthy drink. You need water. We absolutely need water to survive, especially in the month of Ramadan. So drink as much as you can. Like we already said, the quantity depends on where your body size and everything, but drink as much as you can. Yes.
Thank you very much.
Thank you very much, Doctor. I just want to remind viewers that we know physical exercise is very important in Ramadan, and also when not Ramadan is very, very important for the body. And also we want to advise, so those who are also smoking in the Ramadan, we want to appeal to them to use this opportunity in the Ramadan to cease smoking. That's also very important, because I know it also have an effect on us in terms of NCDs. It's also one of the risk factors.
Exactly.
So I also want to emphasize on that. Some of them will say, oh, during Ramadan, I normally don't smoke on the whole day, so I can quit. So one day also appeal to them to use that opportunity of the Ramadan to quit from smoking. That's also very, very important, because really we are seeing what we are seeing in our health facility in terms of smoke-related illnesses or tobacco-related illnesses is not encouraging. So we want to definitely advise people to quit smoking. The other issue is we want to advise the public that still we have COVID around us, and many people think COVID has gone. It has not yet gone. And then we want to tell people to still continue practicing, the hand washing. We have been, advising people, and also wearing of face masks is also very key. And also we want people to take the vaccine. And then we are also encouraged that people are now taking the vaccine, and let them not be hesitant about the vaccine. Let them take it, and it's very good for them, because when the population is immunized against the COVID vaccine virus, I think automatically we can be able to contain the disease. So now the ball is now in our court. We need to take the vaccine for us to protect ourselves and the public, so that we can also now start moving around. We can start our normal life. Because really we have been, we all know what we have gone through as a country, as a nation, and also in a continent, and as well as globally, what we have gone through. So as a result of that, I want to advise people to take the vaccine.
Thank you, colleagues, for joining us today. And dear viewers, we have come to the end of the program. So fasting either can be a month where you will adopt healthy habits, or it can be a month where you will live the most unhealthy habits, depending on what measures you adopt. So we hope that we have had some inspiration or some tips from our experts here on how to make sure that you have a healthy Ramadan this year, inshallah. Stay safe, and see you next week, inshallah.